Good morning. It's Barbara Mel Goldman for Channel 22, and it's a beautiful morning in Sun City Grand. Today I have with me Bill Peter. He's a futurist. He'll tell you about it. We're going to discuss health care and learning from birth to 100, and we're going to have a wonderful discussion this morning. I know Bill, and he is a lovely gentleman. He is certainly a participant in life. I want you to meet Bill Peter.
Hi, Barbara.
Good morning, Bill. It's so nice to have you here.
I guess our first subject, we're going to concentrate on the future of healthcare.
Yes. Bill is a futurist. He is a Sun City Grand resident, a college professor in Minnesota and Arizona, and a business consultant. Bill worked professionally in healthcare for 20 years as a profit center manager of a $300 million healthcare business in the DuPont company, as a consultant and as the CEO of a healthcare computer software company. He's managed businesses and consulted in 15 countries worldwide. He conducts over 50 seminars a year on a wide range of subjects, and his future website is www.2020and2035.com. All right, Bill. Before we begin to talk about healthcare, I want you to tell us, what is a futurist and what do you feel is the future of healthcare system?
A futurist is a person who thinks about and analyzes what likely will happen in the future, develops scenarios on what might happen, what probably will happen, and what we would like to make happen. So a futurist really is a person who is looking to create the future.
I see. Let's discuss as a start the differences between healthcare and health. What do those two terms mean to you?
Well, healthcare is all of the providers. That might include the hospitals and the clinics and the physicians and the nurses, and that combination, including the financing of all of that, could be called the healthcare business. Health, on the other hand, is a very personal thing. It's an individual's health, and the individual is responsible for their own health, and that might be responsibility for their exercise and their diet and how well they take care of themselves, whether they do the appropriate things for the good of their own health. The dilemma between healthcare and health is healthcare has become institutionalized to the point that it is now 17% of the U.S. economy. We don't need to spend that much money, but we are spending that much money because the individuals are not taking enough responsibility for their own health, and we have a very complicated, ineffective, unproductive healthcare system. That sounds negative. Do I want the best healthcare system in the United States? Absolutely. But we're not doing it because we've gotten tremendously complicated and tremendously bureaucratic.
I see. Now, how does that suggest changes for the healthcare system?
Well, I'd like to tell you a little story, and then it'll tie in.
Okay.
My wife has a heart problem, and she got a medication for a heart problem, and it was solving the heart problem. 8 years after she got that medication, she had what she perceived as sinus headaches. Terrible, terrible sinus headaches. She went to the drugstore and said to the drugstore clerk, "I've got this terrible sinus headache." And the clerk said, "No problem, aisle 5. This is the most popular drug for over-the-counter for sinus headaches." My wife says, "You sure?" And she said, "Yes." So my wife pays $3.95 and leaves, takes that drug, but she thinks she's got a rather severe sinus headache. She takes 2 pills instead of 1. Okay?
Yes.
Within 6 hours, she's in the emergency room of the hospital.
Oh, my.
okay, for taking an over-the-counter drug that the clerk recommended when she was on another drug.
Was
Now,
there a warning on the package?
no, not that watch out for this if you have heart problem. Now, if you try to figure out who made the mistake, the original doctor could have said, make sure you don't take this kind of a over-the-counter drug with this one, because that would be a problem.
Yes.
But even if that doctor had said that, that was so many years ago that she might have forgotten it, but he didn't. My wife could have done something better by going and talk to the pharmacist and said, pharmacist, I want to take this over-the-counter drug, but I'm also taking this heart medicine. Will they conflict? The pharmacist would have been able to help her. A doctor would have been able to help her to know that. So the ultimate responsibility for health is yourself.
Yes.
You have the information of what things you're putting into your body. And if you don't tell a pharmacist or a doctor, you don't get the information. So the healthcare system is only as good as the information you give it.
Then what major changes are needed in healthcare?
Well, that's going to take a few minutes because the healthcare is so complicated. Healthcare used to be simple, but I have to go back at least 50 years ago.
All right.
And when it was simple, you went to the doctor talked to you, was not terribly rushed, and you said what your problem was. The doctor knew you because you had a relationship as a family doctor, as opposed to today where you don't have a relationship with that doctor, usually. That doctor knew that there was heart problems in your family history. That doctor delivered your children. That doctor knew that you had asthma. You know, all of these things that are not necessarily true of our way of doing it. That was called fee for service. I went to the doctor. If I wasn't happy with the doctor, I quit that doctor and went to another doctor. Since that time of a relationship with a doctor, we have gotten insurance companies, Medicare, Medicaid, all involved in the system. And it makes it very, very complicated for somebody to get good health care. I'll tell you another story that just...
Before you do, short of going back 50 years, which we can't, and as a futurist you well know that.
I told you that background.
So then what could... We can't go back, so going forward, what could we do in terms of helping these changes come along?
A very, very good point. I'll give you an example of how individuals can be proactive.
All right, thank you.
Individuals, senior citizens, others, need to be proactive. First thing you need to know is you have to write down every pill that you're taking, whether it was an over-the-counter pill or a prescribed pill, and so on.
Yes.
You need to write down how much alcohol you use, how much caffeine you use, everything that might, illegal drugs, whatever it is that you put in your body. So when you go to talk to a professional, a pharmacist, a doctor, and they say, you need another pill, you say, before I take any more pills, doctor, I just want you to know, these are the 10 things that I'm doing, 20 things that I'm doing. The person being proactive and having all that information right at hand can do a good job by helping the professional doctor, nurse, pharmacist. Most people do not carry a full list of all of their drugs. Most people do not carry the over-the-counter drugs and so on, and all of those things are important in your body. So I would say the research shows 99+% don't know the names of all the things that they're taking. And they say, oh, I have a little white one and I have a blue one and so on.
Okay.
And the doctors need to have all those names. And the reason is the doctors and the pharmacists are rushed. And when you come in and you say, I have a bad elbow, all they do is work on your elbow. And if they give you some medicine for the elbow that contradicts something that was for your heart, you have a real problem.
Big trouble.
But you have to tell them everything that you're taking.
Okay.
That's a real concrete thing that people can do.
So what is your future outlook for healthcare?
Well, the future is not tremendously bright unless we do something dramatically different. We need to get people involved giving information. The healthcare system is very ineffective in its use of information. So we've had a revolution in the computer industry. And some segments of society have used computers very effectively. Walmart and its retailing has used computers tremendously effectively. When you buy something at retail, they know where the supply came from, and the supply start resupplying the system so that all those shelves are kept full. The computer information systems at major companies are tremendously effective. Healthcare is around 20 years behind. They have paperwork instead of computer systems. They don't have all your drugs because they never asked you all your drugs. They don't have all of those things. And then you go to one specialist for the heart and another specialist for your feet and another specialist for your hearing, and all your information is not put in one place. The computer technology is available. There's no problem. But healthcare is about 20 years behind in implementing it. And the reason for it is a huge, huge bureaucracy. It is now 17% of the GNP. While I was in the industry, I remember we panicked when we saw it become 12% of the GNP, that the industry was out of control. The left hand doesn't know what the right hand's doing. It is a non-productive, not efficient operation. And when you say, what should we do for it? We need to get the word out that consumers are primarily responsible for their own health. Yes. And if they will get good exercise and watch their diet and control their weight and do all the right things, they'll be better off. And then whenever they talk to a physician, nobody should go to see a physician without written down questions.
That's very important.
The doctors are on a timetable, and they want you in and they want you out because they have to produce for their companies. And people get nervous in front of a doctor because, boy, the doctor is, so important, and his time is important. Well, your time and your life is important too. So if you've got 5 questions, write them down. And when you go in, he says, what's the problem? I've got an earache. And another thing, doctor, I have a bad knee. Well, you don't get questions to the earache and the bad knee unless you make sure that you cover them.
Yes. And make sure that he sends you, if he doesn't have the answers, sends you on to the proper specialist as well.
Well, that's right. But you want to get as much information from this doctor face-to-face as you can. The healthcare industry could improve itself dramatically if the health providers would just establish a form, one piece of paper that says, list here the questions that you have for the doctor. Just to prepare the patient to know that that's what they're supposed to do. List here all the drugs that you've got, so that the doctor is best informed and the patient has done the thinking. I've talked to hundreds of people after they've been to doctors. And they said, I forgot to ask them this. I forgot to ask them that. So the industry could help if it had, here's one piece of paper, list your questions and your drugs. And here's another piece of paper of what did the doctor tell you at the end. When you're talking to a doctor, the doctor says, take these 3 pills, 1 a day, but there's more than that many in there. Make sure that you finish the entire container because it might be something lasts 10 days. We want to make sure that you get rid of all your...
So you write that down. You take all that information.
The doctor should tell you this, but if he doesn't, then you write it down.
Yes.
And then a very pertinent question to ask the doctor is are there any things I should look for that would say this is not working? My breathing is better. That means it's good. What might indicate something is bad? And the doctor says, well, if you're not sleeping or other problems happens, you get short of breath. So you want to know what it is that it's supposed to do that's good, and what should I look for that's bad, and then you ask the doctor, if one of those bad things happens, is it all right if I call you immediately? The doctor will say, sure, if it's not doing what it's supposed to, I want you to call me. Most people are afraid of doctors. They have this syndrome that the doctor is like God.
Yes.
And the doctor says, do this, and they do it. And when I talk to them after they've finished talking to a doctor, they say, I asked them questions. What would you do if this happened? I didn't ask the doctor that. What would you do if this happened? I didn't ask the doctor. Well, you have to.
Yes.
You will get as good a medical treatment as you ask for, but don't expect it, because the industry hasn't institutionalized this to make you write it down coming in, and they should have a piece of paper that as you leave, and they should give it to you and say, these are the things you should look for. Call us under these circumstances. Don't call us under these circumstances. Simple administration.
Yes.
Now, there's many bigger problems that go on with healthcare, but those are the human interaction with physicians and pharmacists and so on
Yes.
that are really critical.
Yes. Bill, I would also say, tell me if I'm right or wrong, if a person is unsure of their ability to register that which the doctor has spoken about, would it be all right or a good idea to take an advocate, someone that is concerned about your health, or a good friend?
Oh, sure.
Then make sure that you get the information you need?
If you feel, you don't want to insult somebody and say you can't understand, but if
Offer to be an advocate.
If the person is willing to have somebody go with them, fine. Now, the advocate should keep quiet unless needed.
Yes.
Because it's the primary responsibility with the patient and the doctor.
But oftentimes people are upset or nervous about their condition, and another outsider hearing it might help them.
Absolutely wonderful. Now, nobody should ever go to the hospital without a friend or a loved one.
Very valuable.
If they go to the hospital, that's really when they're in trauma. That's really when they're upset. Now, it's not just a cold. It's something that's serious. We should never let our friends go to the hospital without somebody who is healthy and cogent.
Make help with
go with them.
decisions and so forth.
That's really important.
Yeah.
Now, we'll go back to a little bit to the healthcare industry, if that's we
just
got time on that.
Just before we do, I want to say that living in Sun City Grand, it's a wonderful place to be, as you well know. And we are provided with a full facility gym, state-of-the-art equipment, wonderful pools and so forth. And I see many people that have follow-up surgery, excuse me, after follow-up surgery, oftentimes they go to therapy that the doctor's ordered for them, and then they have those 8 sessions or 10 or whatever the doctor's ordered of the therapy, and they think that's the end of it, when they could continue with the therapy as a way of life. Right here, it's a no excuses place to be able to exercise and take care of yourself. Weather has nothing to do with it. We live in a wonderful state as far as weather is concerned, but our activity is indoors with a walking track, a pool, and gym. People could continue that therapy for the rest of their life, and maybe right or wrong, maybe they'll never get that situation again by continuing that. And I wanted to stress how important it is with good diet and healthful eating, and especially the exercise, because we know the benefits of that. And I want to tell people that it is a no excuses wonderful place.
Well, Sun City Grand has outstanding facilities. It still takes the human initiative.
Yes, it does.
If you want to be a couch potato and sit in front of the television all day, you can still do it. And
yes.
But
you pay a price for doing that.
Well, that's right. But we still have free will.
Yes, we do.
And so your good advice, I might take half of, and I might take all of. But we have the opportunity, and if we want to be healthy, a little shocking statistic is all of the research says that our maximum life is probably 120 years. We haven't gotten through the 120-year barrier. There's all kinds of gene studies that says 120 years is probably our maximum. When we reach 125, we know we've broken that, and we've learned some new things. So when we say, I've lived a good life, it used to be 70. back when our mothers and grandmothers used to say 70 10, 70 years. Well, 120 is our maximum, and we shouldn't give up at 70 and say, I guess I'm just getting old. Because if you use it or lose it, you use your legs and you keep your legs moving. You use your brain and you keep your brain moving. So use it and lose it is a real healthy medical thing. Let me switch to a little bit about the industry, because
yes, please do.
So many people think that finances is what makes good or bad health care. We just have to spend more money and that will give us good health care. We are spending more than we're getting now. It's not as effective as it should be. And I gave you some examples.
Yes.
I had a personal friend who lived in Philadelphia. And she calls me up in Minnesota and says, Bill, I have a medical problem. I said, well, you know I'm not a doctor. You know, but you're working in the healthcare industry, and I'd just like your personal advice. I said, okay, what is it? She said, I believe that I have ovarian cancer.
Oh, my.
So I went to my doctor, and I said, Doc, I think I have ovarian cancer. And the doctor says, I've done all these tests and checkups. You don't have it. But I think I do, for the following reasons. The doc said, no, wait a second. There's only one definitive test on ovarian cancer, and it's very, very expensive. Your HMO will not approve that test because you haven't got enough of the indications. She said, but I think I've got ovarian cancer. He says, I'm sorry, I can't do that test because your HMO will not approve it. So she goes away, she studies on the internet. She calls me back and she says, Bill, I really still think I've got ovarian cancer. I said, go in and tell him, and here's the strategy. She says, what? I'm a strategist. She says, tell him that if the test comes out positive that you do have ovarian cancer, will they pay for it? And he'll say, sure, if it comes out positive, the HMO will pay for that test. And you tell him that if it comes out negative, you'll pay for it. He can't then resist. She did that, took the test, it came out positive. She did have ovarian cancer. She had the operation. She went dancing and playing golf and all of her activities for another 15 years. But she had to persist.
I see.
The healthcare industry is stuck on the finances and who's going to pay for what test. But even that, a patient has the right, if they study and they think they know something better, say, I'll pay for it if it comes out the other way. And it worked, and she had a better life. Now, that was very satisfying to me that I gave her just a little bit of advice. But her persistence is what made the difference. And that's, people have to get second opinions, and they have to get
excellent strategy.
They have to be an advocate for their own health.
Absolutely. Well, that has certainly been a lesson, and I don't know how you came up with that particular strategy. It obviously worked, and I'm glad that that story had a very good outcome.
Well, in business, I've done a lot of negotiations, and sometimes you look for another way to get around it. I'll tell you a happy story. Maybe we're coming closer to the end here.
Yes.
This is a story that everybody that hears it says, Bill, that could not have happened in healthcare.
Let's hear it.
It's a happy story. And the story is about Dr. Mario. And Dr. Mario was treating my wife. And she had to go in for an operation. And it turns out that as he entered the operating room, he was singing opera. And my wife loves music, and here's this doctor singing opera, and she says, oh boy, I'm so happy. So then he's getting ready to have the anesthesia before the operation, and she says to him, she says out loud, sing to me, Mario. And he continues singing some more opera, and then she has her operation. So she comes out of it, and then goes to visit Dr. Mario, and says, how did it go? What's going to happen next? He said, this is what the process is now. First of all, the operation was a success, and we've concluded that 98% was not malignant problem, okay? And, but we will have the lab results, this is a Tuesday. We'll have the lab results by Thursday. And she says, fine. And he said, I'll let you know when I have the lab results. So this is Tuesday at 10 o'clock in the morning. 2 o'clock in the afternoon on Tuesday, same day as the operation, Dr. Mario calls. And he said, I haven't got the lab results yet, but I just wanted to know, how are you feeling? Is everything going okay? She's surprised, pleasantly surprised, and that's the end of it. He had said it was going to take 2 days for the lab results. Wednesday morning, she gets a phone call from Dr. Mario. And he says, we found the final answer. There was no malignancy. We think we're in good shape. But I just have one other question. Would you call me tomorrow morning that I want to talk to you about? Fine. She calls him tomorrow morning, dials the phone. Who answers the phone? Dr. Mario. And he said, everything's fine. I just want to make sure that there's not an infection that might develop over time. So are you allergic to penicillin, this, that, and the other thing? We want to give you a medication to make sure that there's no infection. So she thinks she's gotten the best doctor in the world. I mean, not only does he sing opera and he's a human being, but he calls her to see how she's feeling. And then he calls with the early laboratory results.
Yes.
And then he calls with the final laboratory results. And then when she calls, he's the one that answers the phone. And so when I tell this story, people say, it could never happen in healthcare because the doctor has other people doing that. And he's not that personable. And he doesn't take that much time.
Yeah.
But this is true. So we wrote a testimonial letter to Dr. Mario and to his administrative boss. Mm-hmm. And we got a response back that said, you don't realize how much we appreciate this, because most of the time we get complaints.
That's true.
Most of the time we get complaints. Now, Dr. Mario's story is true, but the importance of it is this. Doctors need to recognize that their human kindness is important.
Absolutely.
Their reaction to people is important, and they have to do a good job on being a human being. And the key question to ask a doctor is, what would you recommend if I was your mother?
Yes, I've heard that.
If I was your mother, would you give me this extra? When you got the lab result, would you call me right then?
Yeah.
Because your mother would like to know right then.
Yeah, and that makes it more personal, and that is a lovely story. It would have been nice if he would have sung one more song on the telephone. But you see that your wife went in with positive feelings, and there was a kinship there, and that was lovely. It doesn't always happen, but a thank you to the doctor for a job well done is notable, I think. And I want to thank you, Bill, for being here with us today. This was certainly very informative. All of you out there, we're going to tell you where you can get in touch with Bill. And I want to thank you for watching for Barbara Mel Goldman and Channel 22. It's been very